Hello, I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics Plastics. In this video, I want to talk to you about the recovery period after breast reduction surgery and what the patient goes through and when can they finally see the result. Breast reduction surgery is a common procedure performed at our clinic. Normally, this is a day care procedure. What that means is that it is done in the morning and the patient can go home in the evening. There is usually no need for the patient to stay overnight in the hospital. The most common question before getting the procedure done by the patient is that how many times do they have to come in the post-operative period for a follow-up visit. After breast reduction surgery, I usually call my patients on post-op day 4, on post-op day 7, 10, 14, and then finally at 1 month. The initial post-op visits at day 4, 7, 10 and 14 are for checking the wound and to do dressings and to take care of any wound dehiscence that might develop or minor wound problems that might develop, which are usually very rare. Mostly it's for just assessing the wound healing process and whether the patient is healing well in that given period of time. 1 month follow-up is for assessing the results that patient have got. Normally, the breasts take about 3 months to settle after the procedure, but I usually do my final follow-up at 1 month because it's a little difficult for the patients, especially if they are out of town, to come after 3 months. Up till until 1 month, it is usually acceptable for them to be on a regular follow-up. Apart from this, how much pain is there in the post-operative period? So if the patient is going home the same day, then that itself means that there is not going to be a lot of pain in the post-operative period. Usually patients say that they have some mild discomfort which is easily managed with painkillers and they are able to return to work in about 2 or 3 days. Also, it doesn't mean that they are at home resting for 2 or 3 days as a complete bed rest. Normally they are walking about, but after the procedure, they usually take about 2 to 3 days to recuperate and maybe just get used to the little discomfort that they are facing and the medications that they are taking, and that's about it. So if a person wishes, they can return to work the next day itself.